Hey, thanks for joining us. I'm sitting here with Dr. Bilski and talking dental stuff. Big part of dental stuff could be dental insurance. Who has it? Is there much out there? What's out there?
So yeah, those are good questions. Many dental insurance companies, I think, well, I can tell you.
He's struggling. I came ready. There's like 10 of them out there.
There's the top 10 that we use.
There's a top 10. We can't. We got him here. I got you. Let me help. You just sit back.
So I used to copy off of Randy in dental school. He quit. No, he didn't go to dental school. Thank God. But anyway, yeah, there's top 10 that we use in our practice. And I think because I'm doing these videos, I want our patients or potential patients that are coming in to know what we accept and what we don't accept. More specifically, the top 10, I'm just going to read them here. Delta Dental, Cigna Dental, Guardian Dental, MetLife, Aetna, Liberty, Medical Mutual, Anthem, United Healthcare. And then there are some government employee hospital associations. So the question that we get is, and this is why we're doing this video, is are you in network with my or your insurance company? And the answer is yes, and sometimes no. And the difference between in-network and out-of-network is just the way the insurance company views what I do or don't do. All right. So if you follow along here, a little tutorial. So Randy has insurance and he calls up and he says the number one dental insurance company we have is, say, Cigna at the time. Hey, I have Cigna. Are you in network? And of course we are. But if you called up and said, hey, I have United Healthcare, are you in network? We're not in network. And we still can submit your claims.
You can.
I can.
Okay.
And here's the problem with, and I'm not mad at insurance companies for doing this. What I am tired of is when my front desk has to take a phone call and says, Dr. Bilski's not in network. I'm going somewhere else. I'm like, okay, why are you going somewhere else? Well, because of my insurance. Well, you've been here for a few years and you've had your teeth cleaned by Pam and or Danielle and everything's going fine, and you're going to go somewhere where you don't know them.
Yeah. Right. Sure. Yeah.
And we're not trying to play off of the emotion, but it's like, what's going on here? So here's the thing about dental practice. There's nothing that changes if you have insurance or you don't have insurance. If you're in a network or you're not in a network, we are still going to do the same services and provide the optimum care we feel is necessary for you. When you start going into things like network or out of network, and then, well, you're not in network, they're not going to pay. No, they have to pay us. We're not excluded. The insurance companies just use that to help you find somebody else.
Oh.
That traditionally doesn't do services like we do. Or they don't do services at all other than cleanings. Maybe little fillings in our practices, which is fine. There's a niche for everyone. These insurance companies also, when you're in network or out of network, they make the decision on what they feel is dentally or medically necessary.
Oh, the dentist doesn't.
Correct.
Oh, well, that's not exactly.
Right. So, you can play this any way you want. I'm not an attorney. However, it's like, wait a minute, I'm the authority. I'm talking to Randy. We already talked about taking a picture and an x-ray and it's clear what's going on, and I'll give you an example. What a company may feel is necessary and deny it. We have George and Christine. They're married. They have the same insurance company. George gets a crown and George gets a filling. Christine gets a crown, Christine gets a filling. George's gets paid. Christine's got denied.
Why?
We don't know. So we send the pictures, which we take, the x-rays, the narrative, which means a little description of why we did it, the diagnosis, meaning the tooth was decayed and we had to fix it and it was bigger than we could put a filling in, so we use a crown. And essentially almost identical cases, different teeth, but almost identical.
Yeah.
And we had to go through the resubmission, and we asked for a licensed Ohio dentist to review our resubmission. and it gets paid. So it's based on the insurance company. So when you're in network, doesn't mean you're not going to get paid. It just means we don't know what it means. It's just their own rules. So changing the rules while you're playing the game is, I feel, unfair to our patients. So the thing is, we always say is, if we're not in network, we still do the same procedures. That your insurance company will still pay. We submit, we file the reports, we send the pictures, we send the x-rays, we do the narratives, we copy everything we can, and then we ask, if it's not going well, for a licensed Ohio dentist to give us a call. I talk to the dentist.
And then
he or she is usually very nice.
Yeah.
I can see what's going on. Okay, I will pass this on to whoever writes the check, to the accounting staff, and it's paid. So the in-network and out-of-network is just a way for having some patients delay their therapies.
I'd say that's really enlightening.
Yeah.
Because I thought the same thing. It's like if not network, that means I can't go to you, or if I do, it's all money.
Well, that's the operative word. I can't go to you, Dr. Bilski, because we just got new insurance. Like, no, you can. Yeah. We really can submit your forms and request reimbursement for the services that you accepted. And I've been doing this a long time. We're not telling you to do all 32 of your teeth.
Right.
It's one tooth, but that's how it goes. So insurance is very important. Those are our top 10. Most doctors take them all. We're in network with at least those that you've already seen or we talked about.
But if somebody has an 11th card that wasn't here,
come on in. We talk about it. We show you. We recommend. We don't base anything on your dental insurance. Keep in mind, dental insurance only pays a maximum per year.
Yeah.
And I always try to use numbers. Say it's $1,000 just to keep it, that you have dental insurance.
Yeah.
But you need $2,000. And they pay 80% of it.
Okay.
Right? All right. So you have $800 paid for by the insurance company, and then the other 20% of the first 1,000 plus the remainder. That's just how it works.
Yeah.
There's not going to help you if you need a lot of dental work, but those that don't have any dental work, it's a godsend.
Yeah,
really.
yeah, and you can't put that off. Even if
no, you have to keep your mouth healthy, and we want to make the decisions based on what we feel is appropriate optimization of your oral health.
Yeah.
Make my smile look good and my gums healthy, so I don't have any other systemic problems.
I know we've done videos like that on that before.
Yeah.
Hey, as well as great dentistry, you get a lot of great information from Dr. Bilski and his group.
Thank you.
And so check out bilskidental.com and you'll see more videos just like this and learn a lot more. Great stuff just like this. This is a really important one too.
Hey, just come on and visit us. That's bottom line. We'd love to see you. Of course, that's my gig. So thanks for listening. Randy, thank you.
Thank you.